Coronary heart disease is one of the leading causes of death in Scotland. Hi, I'm Niki Walker. I'm a consultant cardiologist based at the Golden Jubilee in Clydebank. I'm the clinical director of the Scottish Adult Congenital Cardiac Service. It sounds like a terrible cliche, but I was interested in the science subjects at school and then wanted to help people. But I think, like most people in medicine, what medicine allows is this incredible integration of really all the STEM subjects, but with that personal interface of the individual patient and trying to make sure that they get the best possible outcomes for the long term. So I would encourage them to be excited and to be proud of who they are. Don't worry what other people think of you. The STEM subjects, they have the answer to most of the world's problems. You want to help hunger? Well, that's biotechnology, that's agriculture, that's engineering. You want clean water, you want clean power for the world. Well, look for engineering solutions there. And within healthcare, we have this amazing culmination of science, technology, engineering, maths in our day-to-day practice. You look at the COVID pandemic and you see the impact that STEM subjects have made. It's everything from statisticians and epidemiologists who are trying to predict what's happening with COVID, right through to the virologists and geneticists deciding actually what the virus itself is doing, the public health teams, and then the pharmaceutical industries developing a vaccine, in fact, multiple vaccines for the COVID pandemic. The engineers that then have had to upscale production lines to allow the delivery of millions of doses of this, the clinicians that are then delivering the doses of vaccines, physios, perfusionists, doctors treating the critically unwell, they're using established pieces of technology in completely novel ways. And all of this is to try and address an unparalleled need for clinical care at this time. So what would my advice be? Yes, be proud of yourself. But most of all, get involved, be interested. Who knows where it will take you? Right now, your future career possibly doesn't even exist, but you can get to develop it. What an opportunity. That's a really sad question to still be asking in 2021, but it does remain relevant. I was incredibly lucky. I had my mum as my role model. She's still working today as a doctor. She describes incredible battles when she was trying to be allowed to study medicine, and it was about being allowed to study medicine, and that was all because she was female. She really had to strive and fight for acceptance. I had a very different pathway. I was absolutely accepted to study medicine, but still within medicine, it's not a level playing field. And I know that that's true in other STEM careers also. I've had the situation where at the end of a very long, complex, detailed consultation, the patient smiled at me and asked when will they get to see the proper doctor. And when you ask, they mean that they're expecting to see the man. In cardiology, there are still fewer women than there are men, and most of us have had to outperform our colleagues to try and gain that recognition and respect. So I think we as women, we have to be the best advocates we can for ourselves and for each other. We need to not fall into the age-old assumptions. And today, there is no excuse where gender, race, religion, any of the likes of this should be barriers to our careers. So the best advice is to ensure that you work and act in a way that really does allow you to be proud of yourself. Innovations are probably the most exciting aspect of any of the STEM careers. And in heart disease and in the treatment of heart disease, we have an incredibly vibrant research community that have very diverse needs. I think the future will be the integration of things like genetics so that you can describe an individual's susceptibility to a condition. And that will allow future personalization of everything from assessments and imaging. What's the right way to try and look at that patient to see if they are affected by the condition and how severe is it? And then you can try and target therapies, and that's everything from pharmacology, so drug treatments, to devices, so different kinds of pacemakers or devices that we put into holes in the heart, that kind of thing, or surgical strategies. And all of these you can try and target in a timely fashion so that you can try and plan your services around that. I think in addition to that, we need to try and use more innovative approaches to things like epidemiology, so that we can try and identify better targets for maybe more population-based healthcare projects. And that's looking at things like deprivation and its impact on heart disease. Education is going to be key, and the resources that, for example, Heart Research UK can deliver, and the different technologies that we can use to try and deliver those education tools, so things like social media, that really attracts a far wider audience than we've ever been able to capture previously. And that's already showing the strength of that. For example, campaigns to target the symptoms of a heart attack so that it's recognised earlier, and then what to do. And the next level of that is identifying that actually women having a heart attack might have slightly different symptoms. And again, highlighting that to the population so that women aren't at a disadvantage if they do present with a heart attack. And I think finally, we shouldn't overlook the innovative use of more established therapies. And so, for example, the impact and benefit of regular exercise, good nutrition, and the prevention, treatment, and cure of cardiac conditions is massive. Just look at the impact that weight loss and regular exercise can have in terms of type 2 diabetes. You can almost cure type 2 diabetes with these roles, and that then has a consequent benefit on the role of heart disease. So innovation is everywhere in heart disease, and that is our future. We are the women taking on heart disease.